We'll first start with the more common and misunderstood, and then move on to some of the most rare and bizarre mental disorders ever recorded. I made this iceberg myself, and this is obviously a very sensitive topic, so viewer discretion is highly advised. Antisocial personality disorder, or ASPD for short, includes well-known conditions like sociopathy and psychopathy. People with ASPD are not necessarily psycho or sociopaths, but on the more extreme end of the spectrum, the condition is where a person consistently shows little to no regard for right and wrong and ignores the rights and feelings of others. People with ASPD may tend to antagonize, manipulate, or treat others harshly with indifference, and they show no guilt or remorse for their behavior. Now keep in mind, I'm not trying to make people with ASPD sound evil, as they often can't help their own behavior, but they are often deceitful and manipulative in order to gain personal profit or pleasure. For example, to obtain money or power. They may lie, act out impulsively, and are more likely to have problems with drugs and alcohol. These behaviors can obviously compound and lead to a higher likelihood of doing criminal activities. One of the hallmarks of ASPD is a lack of empathy, which is a difficulty to understand or share the feelings of others. Though despite this, they can often appear charming and engaging, using such traits to manipulate others. Symptoms of ASPD can be typically seen from the age of 15, but for a diagnosis to be made, a person must be at least 18 years old. ASPD is diagnosed more in men than it is in women, and the behaviors typically peak during the late teens and early 20s, often reducing in intensity by the time a person reaches their 40s. The causes of ASPD are believed to be a combination of genetic and environmental factors, including childhood abuse and neglect. Treatment for ASPD can be challenging, as those with the disorder often don't see a problem with their behavior and have very little desire to change. Therapy might focus on improving social and moral reasoning, but success varies greatly and often depends on the severity of the disorder and whether the person is actually motivated to change, which obviously makes it hard when you see no reason to change. A very famous person with ASPD would be Ted Bundy, as by almost everyone he interacted with, he was described as charming and delightful. But we know that was merely a facade, as he is one of the US's most infamous serial killers with over 20 confirmed victims. He would use his charm and charisma to lure in women and then viciously attack them. When Ted was telling a biographer his story, he said to him that he did not know how to make a genuine friend or have any sort of romantic relationship. Now, to put it in really simple terms, bipolar disorder is a condition that causes big changes in a person's mood and energy. These changes can swing from the highest highs, called mania, to the lowest lows, called depression. Bipolar disorder shows up in many different ways, and each part has its own set of symptoms. Manic episodes are where someone feels super high and over-energetic for at least a week. They might feel all-powerful, talk a lot, sleep very little, and make more risky decisions like spending too much money or making impulsive plans, though it can also result in an increased productivity, as people in a manic episode might get super eager to do typically boring things like clean or work. Hypomanic episodes are like a milder form of mania. People feeling hypomanic are often very energetic and feel great, but they might not even realize they're acting differently than usual. On the other hand, depressive episodes, where someone feels very sad or hopeless for an extended period. Very typical symptoms include losing interest in things they usually like, feeling tired all the time, and eating more or less than usual. And there's also mixed episodes, when symptoms of mania and depression happen simultaneously. It can be very confusing and hard to handle, because the person's mood can change a lot from one moment to the next. There are actually different types of bipolar disorder. Bipolar 1 involves major manic episodes that are so extreme that the sufferer might need hospital care and often involves longer periods of depression. Whereas in bipolar 2, the person has patterns of depressive episodes and later manic episodes without the full-blown mania of bipolar 1. Now, as a real-life example, you saw him in the thumbnail, we have Kanye West. Over the years, Kanye's behavior has occasionally made headlines, from impromptu political rants to extremely unpredictable social media posts. And these actions have often been viewed through the lens of his mental health, particularly after he confirmed his diagnosis. Kanye himself has spoken about experiencing both manic and depressive episodes, which are extremely characteristic of bipolar disorder. Narcissism is essentially when someone is overly focused on themselves to a point where it can negatively affect their life and the lives of those around them. It ranges from simply having a big ego to a serious mental health condition known as narcissistic personality disorder. The term narcissism comes from a story in Roman poetry about a guy named Narcissus. Narcissus was a good-looking young man who wasn't interested in anyone who liked him. Then along comes a nymph, which is like a minor deity that's basically a very attractive woman. Narcissus rejects this nymph, and as a form of punishment, the gods make Narcissus fall in love with his own reflection in a lake. Though he doesn't realize that it's just an image and can't get love back from it. And stuck in his one-sided love affair, he slowly withers away and dies staring at his own reflection. In the realm of narcissism, a little can actually go a long way. Healthy narcissism is akin to a little bit of self-love and being confident, which fosters ambition and resilience, that motivates individuals to set and achieve goals, maintaining a positive self-image without tipping over into arrogance. However, as these narcissistic traits intensify, they begin to shadow over the individual's ability to connect and empathize with others, marking the transition from constructive to destructive destructive narcissism. This middle ground is rife with challenges, as relationships may suffer, and professional environments may become battlegrounds for dominance and recognition. At the extreme end of the spectrum, narcissism swells into an actual aspect of one's personality. Narcissism can show up in two main ways. There's the loud form of narcissism, where someone might be very attention-seeking, manipulative, and overly confident. And there's what's called vulnerable narcissism, which is more subtle, as the person might seem shy or withdrawn, but still has a very fragile ego and is sensitive to how others view them, may have a distorted view of their importance compared to others. Relationships under the strain of narcissistic personality disorder often buckle under the weight of manipulation and lack of genuine connection, while workplace dynamics are marred by conflicts and a relentless pursuit of personal gain over collective success. Major depressive disorder, also known as clinical depression, is a serious mental health condition characterized by persistent feelings of sadness, a lack of interest in enjoyable activities, and a significant reduction in daily functioning. This condition, officially recognized in the 1980s, goes beyond temporary blues and significantly impacts an individual's emotional and physical well-being. Although there's no blood test or physical exam that can diagnose depression outright, doctors may run tests to rule out other conditions that mimic depression. Clinical depression typically starts in a person's 20s and is diagnosed twice as often in women than it is in men. Though this doesn't concretely mean that men get it less, I think it's very likely that they're just less likely to seek help for their depression. The course of the disorder can vary greatly. Some people might experience only one depressive episode in their lives, while others might have recurring episodes. The causes of depression are believed to be a mix of genetic, environmental, and psychological factors. Genetics play a significant role, accounting for about 40% of the risk. Life changes, medication, chronic health problems, and substance abuse can all increase the risk of developing depression. And it also doesn't just affect mood, it can also disrupt sleep, appetite, and general health, leading to a diminished quality of life. Globally, major depressive disorder affected about 163 million people in 2017, showing its widespread impact. Post-traumatic stress disorder, or PTSD, is a serious mental health condition that happens after someone goes through or sees something extremely traumatic. The main signs of PTSD include reliving the trauma over and over again through nightmares and flashbacks, and having severe reactions to anything that reminds the person of the trauma. This can make ordinary situations feel threatening, leading to panic or fear out of nowhere. People with PTSD often try to avoid anything that might bring back those traumatic memories. This means that they might stop doing things they used to enjoy, or avoid seeing people they care about just to keep the memories at bay. They might feel numb or detached from people, making it hard to connect or feel happy. This disorder can also change how people think and feel. They might blame themselves or others for what happened, have trouble remembering parts of the trauma, or feel just generally hopeless. Physical symptoms are part of the package too. People with PTSD may be on edge all the time and can get startled easily. They can also have trouble sleeping or act out aggressively. What causes PTSD and how it shows up can vary a lot from person to person. For example, ongoing stress from things like long-term abuse, or especially things like service in a war, can lead to PTSD. And there's a very famous and extremely horrible case of PTSD. We have the singer Ariana Grande, who was diagnosed with the disorder after a planned attack at one of her concerts in 2017 ended the lives of 22 people in the crowd. She actually shared a brain scan of hers on Instagram that showed the comparison between a typical healthy brain and her own with PTSD, and you can actually see from the scan the physical impact that PTSD has. We're now moving on to level 2. Schizophrenia is a complex and often misunderstood mental disorder that affects a person's perception of reality, leading to significant impacts on daily life and just functioning in general. It's characterized by episodes of psychosis, a lack of emotional responsiveness, and a general warped interpretation of reality. Individuals with schizophrenia may experience a wide range of symptoms, which are typically divided into 3 different categories: positive, negative, and cognitive. Positive symptoms are not actually positive, and they refer to the presence of psychotic behaviors that are not seen in healthy individuals. These include hallucinations, with auditory hallucinations being the most common form, where individuals hear voices that aren't actually present. Delusions are another positive symptom, which are false beliefs that are not based in reality, such as paranoia, or the belief that one has exceptional abilities like superpowers, or is being persecuted. There's also general disorganized thinking, where thought processes become severely impaired, leading to nonsensical speech or thoughts. Negative symptoms are characterized by disruptions in normal emotions and behaviors, manifesting as a notable decrease in the expression of emotions, speech, motivation, and the ability to derive pleasure from life. These symptoms include a blunted effect, where a person's emotional range is significantly reduced by not being able to properly speak, or a complete lack of interest in social interactions, and a significantly reduced motivation to complete tasks. Cognitive symptoms involve changes in memory and other aspects of thinking. Schizophrenia can lead to trouble concentrating, difficulty in following instructions, and problems with working memory, which can significantly affect the ability to perform daily tasks. The onset of schizophrenia is most common in young adulthood, with symptoms gradually developing and affecting affecting individuals throughout their lives. Diagnosis is based on observed behavior, a psychiatric history, and reports with others familiar with the individual, as there's no objective diagnostic test for the disorder. For an official diagnosis, symptoms must have been present for a significant duration, being at least 6 months according to the DSM-5 criteria, which is basically like a big book that categorizes every major mental disorder and disability. The prevalence of schizophrenia is relatively low, with estimates suggesting that about 0.3 to 0.7% of people are diagnosed with it during their lifetime. However, its impact on an individual is often very, very noticeable. Treating schizophrenia primarily involves antipsychotic medications, which can reduce the severity of the positive symptoms, and for many people, these medications can actually be life-changing. Obsessive-compulsive disorder, or OCD for short, is a condition where a person gets caught in, to put it simply, a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive thoughts or images, or urges that trigger intensely uncomfortable feelings. Compulsions are behaviors an individual feels compelled to do in an attempt to ease their distress or get rid of the obsessions. Despite efforts to ignore or get rid of the thoughts or urges, they keep coming back, leading to a ritualistic behavior, which can be called the cycle of OCD. OCD significantly impacts daily life, making simple tasks difficult and time-consuming. For instance, someone with an obsession about cleanliness might wash their hands repeatedly out of fear they've been contaminated. Having your mind often race about irrational things can obviously reduce productivity at work, at school, and lead to significant stress. The cause of OCD isn't fully understood, but it's believed to be related to a combination of genetics and environmental factors. For example, if someone in your family has OCD, there's a higher chance that you might have it. Now, body dysmorphia can come in many different forms, but generally, people with it are very deeply concerned about their body image to a point where they might imagine defects or really exaggerate specific aspects of their body in their mind, believing it looks really bad when others don't really see it that way. For some, these concerns can be so severe that they believe they see something different in the mirror than what's really there. They might spend hours checking their appearance in the mirror, comparing themselves to others, and even avoiding going out in public. Body dysmorphia typically starts in the teenage years and affects both men and women, but it is more commonly diagnosed in women. In our world today, with everyone on social media and the pressure to look perfect in every Instagram post, it's easy to see why people develop body dysmorphia. People, especially young women, often compare themselves to the heavily edited and perfectly lit and framed images they see online, which can make them feel inadequate. There has been a lot of research done on the topic, and a lot of them find that heavy use of social media can make these feelings a lot worse, leading to dissatisfaction with one's own body and even depression. This constant need for social approval through likes and comments can obviously really affect someone's self-esteem. One of the main symptoms of the disorder is driving people to seek plastic surgeries to try and look like the perfect images they see, which is sometimes referred to as Snapchat dysmorphia, as they want to look like the filtered versions of themselves that they post online, which are obviously completely unrealistic. But for a type of body dysmorphia that isn't talked about as often is muscle dysmorphia, seen often in bodybuilders who never feel muscular enough no matter how big they are. Their delusion then leads them to substances like steroids to build more muscle faster, which obviously comes with a whole litany of health issues like weakening your bones and increasing your likelihood to have serious heart problems. Dementia is essentially a decline in cognitive function severe enough to interfere with daily life. And it's not just one disease, it's a term covering a wide range of specific medical conditions, including Alzheimer's, which makes up about 60 to 70% of cases. At its core, dementia affects memory, thinking, and behavior, worsening over time. This makes everyday tasks challenging, as it also often alters emotions and personalities, leading to apathy or agitation among its sufferers. The onset of dementia is gradual, starting with mild forgetfulness, and eventually advancing to a stage where basic self-care becomes impossible. The progression heavily impacts not only the individual affected with the condition, but also places a significant burden on their families and caregivers. Dementia occurs due to damage in brain cells, disrupting the communication between them, which affects thoughts, behaviors, and feelings, advancing to a stage where basic self-care becomes impossible as you start to forget nearly everything. Currently, no cure exists for most types of dementia, but treatments can slow progression and can improve quality of life. Agoraphobia is an intense anxiety disorder that deeply affects an individual's ability to function in daily life. It's marked by a strong fear of being in places or situations which escape from might be difficult or embarrassing, or where help might not be immediately available in case of a panic attack. This can apply to various settings, such as any open spaces, crowded areas, public transport, or most commonly, just being anywhere outside your own home. The overwhelming need to avoid such situations can obviously restrict a person's life, limiting their ability to work and socialize and perform everyday tasks, as people with agoraphobia will more often than not just want to spend all day every day in their home in order to avoid the unwanted scenarios. Treatment of it usually involves cognitive behavioral therapy, or CBT, which helps change thought patterns behind fear and avoidance behaviors. Medication can also play a role in managing its symptoms, and whilst researching, I even saw that newer methods like virtual reality therapy are being explored as well. We're now moving on to level 3. Witzelsucht is a German word, and I tried my best to pronounce it. It's a neurological condition where people compulsively make jokes, puns, and tell stories that aren't appropriate for the situation. This behavior is somewhat automatic and uncontrollable, leading to awkward social scenarios as people with the condition can't tell that their jokes are out of place. They don't get sarcasm and often can't stop themselves from making especially sexual jokes at the wrong times. The disorder mainly affects those with damage to the frontal lobe of their brain, especially the right side, due to injury or diseases like tumors. They might get that a joke is supposed to be funny, but they don't react normally. They might not laugh or might laugh at the wrong time because they're missing the emotional connection to the humor. Daily life for someone with the condition can be tough, as their constant inappropriate joking can push people away, making social interactions and maintaining relationships slightly harder as they don't realize their behavior is odd, which only adds to the social awkwardness. The brain's frontal lobes are essential for controlling personality, humor, and how we act in social situations. Damage here messes with these abilities, leading to Witzelsucht. Scrupulosity is a form of OCD where a person experiences an intense anxiety and guilt about moral and religious issues. This disorder makes individuals obsess over their own actions and thoughts, fearing constantly that they've sinned or done something wrong, even when their concerns are unfounded. It's like having a conscience that's always on high alert, making everyday decisions that you wouldn't even think about twice a source of severe stress. People with scrupulosity get stuck in a cycle of worrying over moral and religious perfection. They might constantly question their own goodness, fear divine punishment for their perceived sins, or engage in endless rituals to ease their guilt, like excessive praying or confessing constantly. Unlike someone who's simply devout or religiously observant, someone with the disorder feels trapped and tormented by these thoughts, often recognizing them as irrational but feeling powerless to stop them. As ordinary tasks and decisions become loaded with anxiety about potential moral failures, it can isolate individuals as they might avoid social situations or activities that trigger these thoughts. Relationships, work, and school can also suffer because so much time and energy go into managing their obsessive thoughts and compulsive behaviors. It's hard to say exactly how many people suffer from the disorder because it overlaps with religious practices and beliefs as a whole. DID, or dissociative identity disorder, which was previously known as multiple personality disorder, involves a person having more than one distinct identity or personality state that controls their behavior at different times. And these identities are not just simple mood changes, they're profound shifts in a person's self of sense, complete with their own names, histories, and behaviors. Key features of DID include significant memory gaps not explained by ordinary forgetfulness. People with DID might lose track of time, forget personal information, or engage in activities they have no memory of, as they kind of literally switched from person to person, which can obviously be confusing and distressing. The root cause of DID is often linked to severe and prolonged trauma during early childhood. The disorder is thought to develop as a coping mechanism to escape from the reality of the trauma, with different identities handling different aspects of a person's life or trauma they can't deal with. Kleptomania, derived from the Greek words klepto, meaning to steal, and mania, meaning mad desire or compulsion, is where a person just can't resist the urge to steal things that they would never actually need for personal use or even how much it costs. This disorder was first described in 1816 and falls under the category of impulse control disorders in psychiatry. It has characteristics that overlap with OCD, addiction, and mood disorders, making it more complex than it might seem. The disorder's primary features include recurrent intrusive thoughts about stealing and an overwhelming inability to resist the urge to steal, followed by a brief release of tension after the act, which make it mechanically very similar to OCD. People grappling with kleptomania often find themselves in a cycle of intense stress, guilt, and then remorse. Experts believe that kleptomania is developed from a mix of learned behaviors and thought patterns that reinforce the stealing behavior. For example, the act of stealing might be reinforced if it relieves stress or emotional discomfort and there's no immediate negative consequences, like shoplifting small items from shops. Diagnosing kleptomania obviously involves distinguishing it from actual regular theft, focusing on the lack of necessity or financial motivation behind the thievery and the presence of an irresistible impulse. Alice in Wonderland syndrome significantly alters how a person perceives their environment. This disorder can make things look bigger, which is called macropsia, or smaller, which is called micropsia, or closer to you than it actually is, or further away than it actually is. It's not just about vision though. Alice in Wonderland syndrome can also mess with the other senses, making certain sounds seem louder or quieter. It can distort how things feel, and even warp the sense of time. The actual cause of the syndrome is a bit of a mystery. However, it's often linked to migraines, head injuries, and certain infections. Alice in Wonderland syndrome is mostly seen in children, meaning it could be related to brain development. People with the condition might feel like their body is growing or shrinking, and besides these visual tricks, Alice in Wonderland syndrome can actually bring on migraines, dizziness, and nausea. We're now moving on to level 4. Prosopagnosia, also known as face blindness, is a disorder where people can't recognize faces, even of those of close friends, family, or even their own in a mirror. This doesn't affect their ability to understand other visual information or their intellectual abilities. It specifically targets facial recognition. There are two main forms of prosopagnosia, one that people are actually born with, called congenital, or developmental prosopagnosia, which affects about 2.5% of the population. And there's also a third that occurs after brain damage, known as acquired prosopagnosia. For people with the disorder, they have to rely on a more general object recognition system, like how you would remember a street or where a shop is, which is less efficient for faces. On the other hand, those with congenital prosopagnosia have never been able to recognize faces properly right from childhood. But people with it often learn to recognize others through indirect clues, like their voice, hair, clothes, or way of walking. People might not realize they actually have it until they're older, because they've adapted without knowing their adaptation isn't actually the norm. In the words of someone who has the condition, Brad Pitt, in a 2013 interview, he said that his inability to recognize people's faces has become so severe that it often made him want to stay home. Depersonalization derealization disorder, or DPDR, is when people feel very disconnected from themselves and the world around them. It's like watching yourself from the outside or living in a dream, where everything feels foggy and unreal and slightly uncanny. The depersonalization part is feeling detached from your thoughts, feelings, or body. It's like being an observer in your own life, not really in control of what you're doing or what you're saying. Like, I imagine it's comparable to watching a film about someone's life. You feel connected to the character, but you aren't the character. The derealization part is when the world around you feels strange or dreamlike. Things and people might seem blurry or distorted, making you feel isolated or separated from everything. It's often linked to severe stress or trauma, especially from early childhood experiences like emotional abuse or neglect. These traumatic events can trigger feelings of depersonalization and derealization as a way to cope. People with DPDR often have problems with concentration, memory, and feeling emotionally numb, as it's tough to connect with others or enjoy life when you feel that you aren't really living your own. Capgras syndrome is a mental health condition where someone believes a close friend, family member, or pet has been replaced by an identical imposter. It's named after Joseph Capgras, a French psychiatrist who first identified it. This disorder is one kind of delusional misidentification syndrome, meaning it involves false beliefs about people, places, or objects. It's often seen in people with psychotic disorders like schizophrenia, but can also show up in individuals with brain injuries, dementia, or neurodegenerative diseases. Sometimes conditions like diabetes or even certain medications can trigger it. Interestingly, it affects women more than men. Capgras syndrome can seriously cause stress, fear, and confusion, and obviously lead to a strained relationship, especially with the supposed imposter. Clinical cases have shown us just how varied and complex Capgras syndrome can be. For example, in one case report written by Dr. Kevin Parser and Dr. Julia Warnock, Mrs. D, a 74-year-old married housewife, recently discharged from a local hospital after her first psychiatric admission. She was presented to our facility for a second opinion. At the time of her admission earlier in the year, she had received the diagnosis of atypical psychosis because of her belief that her husband had been replaced by another unrelated man. She refused to sleep with the imposter, locked her bedroom and door at night, asked her son for a gun, and finally fought with the police when attempts were made to hospitalize her. At times she believed her husband was her long-deceased father, though she easily recognized other family members and would misidentify her husband only. Researchers believe that Capgras syndrome has something to do with problems in your brain, specifically areas that recognize faces and process the emotions connected to those faces. If something disrupts the connection between these areas, it might make someone recognize a face but feel something is off, an uncanny sort of feeling, leading to the belief that the person has been replaced. Some studies suggest problems with memory and emotional responses to familiar faces also play a role. There's no standard test for Capgras syndrome, though diagnosis usually happens through psychiatric evaluation, often initiated by the imposter family member or friend. Cotard syndrome, sometimes called walking corpse syndrome, is a rare mental health condition where someone believes that they're dead, don't exist, are rotting, or have somehow lost their vital internal organs. It was first described by Jules Cotard in 1880 as a state where a person denies their existence to extreme levels, which can range to believing they're literally a walking corpse. It's typically brought on after a near-death experience or after actually dying for a few minutes and being revived. The person will then think they actually did die and refuse to believe anything otherwise. Despite the seriousness of its symptoms, Cotard syndrome isn't recognized in major diagnostic manuals like the DSM-5, making it a bit of a mystery in psychiatry. The condition typically unfolds in 3 stages. It starts with symptoms like depression and hypochondria, then it evolves into full-blown self-denial, and then the sufferers eventually end up in a chronic state of these delusions, along with severe depression. People with Cotard syndrome often withdraw from others, neglecting their hygiene and health because they literally don't believe they exist or are already dead. I mean, why would you brush your teeth or even eat at all if you're already dead? There are some strange cases that show how varied Cotard syndrome can be. For example, in the case of Warren McKinley, who after a near-deadly motorbike accident developed Cotard syndrome and ate and drank very little, as he obviously didn't need to, as he thought he was already dead. Though by sheer chance, as in a rehab clinic, he met and befriended another sufferer of Cotard's, and together they were able to help each other out of the delusion. Mirrored self-misidentification is a complex and relatively rare psychological disorder characterized by a patient's persistent belief that the reflection seen in a mirror is not actually their own, but rather a different person. The delusion may manifest as the patient perceiving the reflection to be a younger or alternate version of themselves, or an unknown individual, or even a relative. Though interestingly, people with this disorder can still recognize other people's reflections correctly. This condition mainly appears in individuals with dementia, such as Alzheimer's disease, but can also arise from brain injuries, strokes, or less commonly, Parkinson's disease. Diagnosing it is tricky because patients often have multiple health issues that can mask the symptoms of the disorder. Plus, standard medical evaluations might overlook it due to the more prominent cognitive problems. For those with the condition, doing things like getting ready and getting dressed can be quite stressful, as imagine not recognizing yourself every time you look in the mirror, feeling like a stranger is looking back at you. We're now moving on to level 5 of the iceberg. Dissociative fugue is a rare mental disorder where a person loses memory of their identity and may end up traveling far from home or where they usually spend their time without knowing how or why. This condition can lead to someone starting a completely new life under a new identity, all while having no recollection of their previous self. It's often triggered by severe stress or trauma, especially from events like childhood abuse, where the mind tries to protect itself by forgetting these painful memories. Its symptoms include not just memory loss, but also feelings of depression, shame, guilt, and sometimes anger from the people when they come out of the fugue state and realize what's happened and how much time they've wasted. Diagnosing dissociative fugue is tricky because its symptoms overlap with other disorders like dissociative amnesia and dissociative identity disorder. The key feature that sets it apart though is the unexpected traveling or wandering. Recovery from a dissociative fugue is usually quick once the episode ends, and many people only experience it once. A case of dissociative fugue that I found interesting was that of Jeff Ingham. Jeff appeared in Denver in 2006 with absolutely no memory of his past life, including his own name. He described himself frantically searching his own pockets for an ID to give him a clue as to who or maybe where he was, but he had nothing on him. After days of meandering, he eventually somehow made his way onto television to ask America if anyone recognized him so he could remember who he was. And his wife, Penny, fortunately saw his message and they were reunited. Ingram has experienced 3 incidences of this fugue state, one in 1994, one in 2006, and one in 2007, with his longest lasting a whole 9 months. Syndrome of subjective doubles, or what I'll be referring to as doppelganger syndrome, is where someone firmly believes they have one or more identical doubles, and these doubles look exactly like them, but usually act differently and seem to live separate lives. Individuals with this syndrome are convinced about the existence of their double, despite any proof against it. Often they may experience paranoia about their double and the life they lead whilst looking exactly like them. It's often diagnosed alongside other serious mental illnesses like schizophrenia, which can make the situation more complicated, as the symptoms of the syndrome can worsen effects of the other mental health issues. Mistaking people for their double can obviously damage relationships, and in some cases, the person might act aggressively or even violently towards those they believe are their doubles. Clinical lycanthropy is a rare psychological condition where individuals believe they can transform into animals or have already done so. The belief isn't just about feeling like an animal in a metaphorical sense, it's a genuine conviction that they are an animal, and it affects how they think, feel, and act. The term comes from the myth of lycanthropy, which is the mythological term for turning into a werewolf, but obviously in reality, it's a mental health issue. People with clinical lycanthropy might act in ways that mimic animal behavior, such as howling, growling, or moving on all fours. To diagnose someone with it, doctors look for these kinds of behaviors or clear statement from the person that they feel or have felt that they're turning into an animal. They're usually part of larger mental health problems like schizophrenia or bipolar disorder. It's not a standalone diagnosis, but a symptom that indicates something else is going on with a person's mental health. Neurological studies have found unusual brain activity in people with the condition, suggesting that their experiences of transforming might feel very real to them. The Truman Show delusion is a mental condition where people believe they're the main character in a fake reality show watched by millions through hidden cameras. The idea comes from the 1998 movie The Truman Show, where Jim Carrey's character, Truman Burbank, doesn't realize he's living inside a reality TV show. Brothers Joe Gold and Ian Gold, a psychiatrist and neurophilosopher, noticed this pattern in patients around 2008, naming the delusion after the movie. The Truman Show delusion falls into a category of delusions where people feel persecuted or spied on. And as our world and technology evolved, so did the themes of people's delusions. Where once people might have believed in being controlled by magic or political forces, now they're more likely to think they're being tracked by tech like hidden cameras, microchips, or whatever else. The Gold brothers have talked to many people who are convinced they're living in their own Truman Show, and some have gone to great lengths like checking if big news events were staged for their show, or trying to escape the surveillance they believe they're under. Some psychiatrists have described similar symptoms as part of the Truman Show delusion, which they think could be an early sign of schizophrenia. This includes feeling that the world has somehow changed in a way that's obvious to everyone but them, leading them to believe they're in a movie or in a fake setting. Munchausen syndrome, also known as fictitious disorder, is a very rare mental disorder in which a person fakes an illness. People who suffer from this syndrome may lie about their symptoms, make themselves look sick, or even worse, purposely take actions that may negatively affect their health. The most common form of the condition is called Munchausen syndrome by proxy, as in this form of the disorder, a caregiver, often a parent, exaggerates or causes illnesses in another person, normally their child, to attract sympathy or attention for themselves. This can include deliberately harming the person, giving them unnecessary medications, or even altering medical records to make it seem like the person is sick. People with Munchausen syndrome often know that their actions are causing the symptoms, but they may not understand why they behave this way or even see their behavior as any sort of problem. One of the most infamous real-life examples of this condition is the case of Gypsy Rose Blanchard. Gypsy Rose was a young woman who grew up believing she suffered from a range of serious illnesses, including leukemia, muscular dystrophy, and epilepsy, among others. Her mother, Dee Dee Blanchard, was her primary caregiver and was highly involved in Gypsy Rose's medical care. As Gypsy Rose grew older, she began to question her mother's claims and started looking for information and support online. She eventually realized that many of her supposed illnesses were fabricated by her mother and that she was not actually sick at all. Feeling trapped and desperate to escape her mother's control, Gypsy Rose conspired with her boyfriend, Nicholas Gojon, to murder her mother in 2015. After the murder, Gypsy Rose pleaded guilty to second-degree murder and was paroled after spending 8 years in prison, whereas Nicholas was convicted of first-degree murder and was sentenced to life in prison. Stendhal syndrome, also called Florence syndrome, is where people experience physical and psychological symptoms like rapid heartbeats, fainting, confusion, and even hallucinations when they're exposed to particularly beautiful art or cultural environments. The syndrome is named after the French author Stendhal, which was the pen name of Marie-Henri Beyle, who wrote about his experience in Florence in 1817 as he was absorbed in the contemplation of sublime beauty when he was walking around the town. He visited the Basilica di Santa Croce, where the tombs of famous figures like Machiavelli and Michelangelo are located. He felt deeply moved and reported having heart palpitations, dizziness, and an ecstatic sensation that overwhelmed him to the point of feeling like he might faint. While it might seem silly, the physical symptoms seen in some people are serious enough that they might need medical help. Doctors at one of the hospitals within Florence are accustomed to tourists feeling dizzy or confused after viewing artworks like Michelangelo's David or the masterpieces within the Uffizi Gallery, which is an art museum in Florence. The birth of Venus in particular seems to be one of the most common triggers for the disorder, as Ike Schmidt, the director of the Uffizi, says that he's witnessed at least one epileptic attack before the Venus, as well as the fact that he's seen one gentleman also suffer a heart attack upon viewing the painting. The Fragoli delusion involves the firm belief that different people are in fact a single individual who changes appearance or disguises themselves to interact with the sufferer in multiple guises. It was named after Leopoldo Fragoli, an Italian actor who is renowned for his rapid costume changes on stage. The Fragoli delusion can stem from various issues like damage to specific areas of the brain, or even as a side effect from other medications like levodopa, which is used with Parkinson's disease. Faces can get very, very hard to recognize and might all resemble kind of the same person, thus triggering the delusion. Living with the Fragoli delusion can obviously be extremely challenging and stressful, as people under it often have the constant fear of being pursued, which can obviously lead to even more anxiety and social isolation. We're now moving on to level 6. Stockholm Syndrome is when hostages or abuse victims form bonds with their captors or abusers, which obviously goes against every natural instinct to dislike people who harm us. People in these situations sometimes develop positive feelings towards their captors, which can be hard to study and understand due to its rarity and how complex it is. The term comes from a failed bank robbery in Stockholm, Sweden in 1973, where the hostages really started to sympathize with their captors, thus leading to the term Stockholm Syndrome. Stockholm Syndrome is rare and not fully recognized in psychiatric circles, and is not listed in any major diagnostic manuals like the DSM. Patty Hearst is often mentioned when people talk about Stockholm Syndrome, as she's likely the most infamous case of it. In 1974, when she was just 19 years old, a group of armed individuals broke into her apartment, attacked her fiancé, and kidnapped her. They were members of a group called the Symbionese Liberation Army, or the SLA for short, who said they took her to use as leverage to get their members, who were in jail for murder, released. When their initial demands weren't met, the SLA asked Hearst's family to give $70 worth of food to every needy person in California, a project that would cost about $400 million million. In response, her father got a loan to donate $2 million worth of food in the Bay Area, though unfortunately the distribution was chaotic and the SLA was not satisfied, so they did not release Hearst. During her captivity, Patty was kept blindfolded in a closet for a week, with her hands tied, and was constantly threatened with death. Over time, she was allowed out for meals, but remained blindfolded. She was eventually involved and integrated in the group's political discussions, and was given writings by the group to study. She eventually decided to stay and took part in their activities, including a bank robbery, where she was caught on camera ordering around civilians. In 1975, the FBI finally caught her, where she was actually put on trial and initially received a 35-year prison sentence, which was later reduced to 7 years. At her trial, Patty's defense was that she was brainwashed, and by the time she was arrested, she had lost a lot of weight, weighing only 87 pounds, and tests showed her IQ had dropped by about 20 points since she had last taken one prior to being kidnapped. Expert witnesses described her as being deeply affected by her experience, to the point where one doctor called her situation a classic case of brainwashing. Patty was in prison for 2 years before President Jimmy Carter shortened her sentence. After her release, she managed to rebuild her life as she got married, had children, and even acted in some films. Delusional parasitosis, also known as Ekbom syndrome, is where individuals are absolutely convinced they're infested with parasites, bugs, or other pathogens, despite obviously not being. The main sensation is that insects are crawling in or under your skin, and as sufferers attempt to remove these non-existent parasites, they may cause real skin damage through persistent itching or scratching, or applying harmful chemicals to clean them out. Many people with the disorder collect what they believe is evidence of the parasites, which in reality are little skin flakes or small fibers, which they bring to their doctors in small containers, which acts as a hallmark of the condition and reflects how much they truly believe they're infested. The condition is recognized in the DSM-5 as a type of delusional disorder, and despite being a completely standalone mental illness, due to its very unusual nature, Ekbom's is often misunderstood by the public and sometimes even by healthcare professionals. Alien hand syndrome, also called Dr. Strangelove syndrome, is where a person's limb, usually their left hand, seems to move on its own without the person wanting it to or even being aware of what it's doing until it happens. This could include grabbing things, touching unwanted objects, or carrying out actions that are the opposite to what the person intended, sometimes leading to the individual using their other hand to stop the alien hand. This syndrome can come about from various conditions and medical procedures. It's often seen in people who have undergone surgery to separate the brain's two hemispheres, which is sometimes done to treat severe epilepsy. However, alien hand syndrome can also result from brain injuries like strokes, tumors or infections, or degenerative diseases like Alzheimer's. It's also linked to damage in specific areas of the brain, which play roles in controlling movement and intention. Some people with alien hand syndrome might personify their uncontrollable hand, giving it names or attributing actions to it as if it had its own personality. Diagnosing and managing alien hand syndrome can be challenging, as treatment basically focuses on managing its symptoms, which might involve keeping the alien hand busy or using methods to control its movements. We're now on level 7 of the iceberg. Body integrity dysphoria, or BID, is a rare condition where people feel a strong mismatch between their physical body and how they perceive their body should be. This condition usually starts in adolescence and can lead to seriously dangerous behaviors, as sufferers may attempt to align their physical reality with their mental image of themselves. This can include wanting to amputate a perfectly healthy limb or wishing to become blind or deaf because there's a profound discomfort or dissatisfaction with being able-bodied. Some people with the condition might use tools like wheelchairs, prosthetics, or devices that limit hearing or sight, which can sometimes in a backwards sort of way alleviate the discomfort. And many people with BID remember meeting or seeing someone with an obvious physical disability in early life. The condition is more commonly reported in males. There's no standard treatment for BID. There's some approaches like CBT and antidepressants have been tried, but success greatly varies. Surgical amputation, desired by some sufferers, obviously poses an ethical dilemma for the medical professionals, and obviously isn't the right route to go down, even if it will make the BID sufferer happier in the short term. People who actually seek to become disabled are sometimes referred to by the term as transabled, as they seek to acquire disability even though they weren't born with one. And that concludes today's video. If you enjoyed it, subscribe, and if you want something else to watch or listen to, you can check out one of my other videos. Thanks for watching.